Assalamualaikum to Sir Muhammad Faizal. Today, we will present our group risk assessment assignments. So, for your information, our chosen industry is healthcare industry. So, I will start by giving an introduction to the healthcare industry. Okay, the healthcare industry aims to preserve and improve health through the prevention, diagnosis, treatment, and management of disease and injuries. This involves professionals like doctors, nurses, pharmacists, and therapists. They are working together to promote community health. To ensure safety and efficacy, healthcare constantly assesses risks in key areas such as medical practices, medication management, infection control, staff training, and equipment maintenance. These practices are crucial across all sectors, including hospitals, clinic, long-term care facilities, home healthcare, pharmaceutical companies, medical device manufacturer, and health insurance providers. The goal of ongoing risk assessment is to maintain high standard of care by identifying, assessing, and mitigating risks. This enables the healthcare sector to provide safe and effective services amidst new challenges and technologies.
On my part, which is the potential risk and cost effect related to the healthcare industry. So first and foremost, for risk, we need to acknowledge that risk is unavoidable and is part of our everyday life. This includes in any business or any industry, especially in the healthcare industry, as what we are presenting. So first, the definition for risk is the possibility of something bad from happening. However, for risk, we believe that it can be mitigated by selecting the right response and monitoring. In healthcare, risk management incorporates systems and processes to identify, lessen, and prevent risks in healthcare institutions. Clinical and administrative system, processes, or reports are employed to identify, monitor, evaluate, decrease, and discourage threats to healthcare. Through the implementation of management tools, a risk management system allows the health organization to actively and effectively protect patient safety, as well as the organization asset, market share, asset reputation, reinvestment level, brand value, and also community standing. We have identified the risk, causes and effects in the healthcare industry, and be able to determine the three we feel that is can be on the high side on the risk, which is we consider as a high risk with the healthcare industry. So first, we'll look into the operational risks. So one of the causes can be workflow inefficiencies. It can be due to delays in patient care. The second one will be inadequate staffing. This can be increased on the operational costs if there's no proper or inadequate staffing that we believe. Equipment failures can also be one of the risks in operation, which this can affect on the reduce of the quality of care between the staff and the patient. Second one, we look into the financial risks. One could be due to budget cuts, causes of the financial risk, which then leads into financial losses, which means that as a business, they cannot expand further if the budget cuts. Uncompensated care on our second cost for financial risk, which can reduce into funding for the services. The third one for financial risk can be in terms of fraud and abuse. And this can, the potential effects will be legal penalties from internal or external stakeholder. So the third one will be clinical and patient safety risks in terms of medication errors. It can harm the patients, which affects this. So there are precautions needed to take to ensure that they will prescribe to their patients. There's no prescribing errors such as dosing error or even medication error, which this can affect the patient. Second one would be infections. So there's an increase of hospital stays, which the error comes from the healthcare itself. This will lead to losses and also diagnosis error. And this can come for legal liabilities, as this can be sued by the patient to the healthcare or to the hospital uh, if there's any diagnosis error. So for the cost effect and also for the risk, these are the potential risks and cost effect related to healthcare industry. And for the other part, my group mate will present to you in the next slide. Thank you.
Today, I will present about evaluation of the potential risk in the healthcare industry. Healthcare industry is faced with a multitude of threats that can have significant impact on patient care, financial health, and operational efficiency. Moreover, in practice, effective risk management methods are introduced and the risks need to be identified and appraised. These categories pertain to healthcare sector risks, since the primary relevance for this assessment will be operational risk, financial risk, and clinical and patient safety risk. Finally, we offer points elaborating further on the challenges faced by healthcare professionals in ensuring quality and safety of health delivery under each category, including possible reasons for those problems along with its impact as well as possibility. Based on this evaluation of potential risk, operational risk was rated high based on the objective data analysis that has shown workflow inefficiencies happen too frequently. Unfortunately, staffing issues and faulty equipment malfunction in healthcare setting is a known fact for such events. Financial risks were middle rank, with medium risk due to repeated but sporadic budget cuts and money constraints as opposed to operationally being an ongoing hurdle. Finally, clinical and patient safety risks scored medium as medicine errors, infection and diagnostic harms happen in healthcare setting, but these are not highly prevalent due to stringent protocols of healthcare institutions.
Today I will presenting on the critical aspect of this impact in the healthcare industry. Our focus will be on understanding the risk matrix and essential strategies for managing this risk to ensure the highest standard of patient care and organizational efficiency. In the healthcare industry, the impact of risk can be profound and affecting everything from patient safety to financial stability. The risk matrix is an invaluable tool used to assess the severity and likelihood of potential risks. This matrix helps healthcare organization prioritize risk and implement appropriate control measures. The risk matrix evaluates risk based on two main dimensions: the severity of the consequences and the likelihood of occurrence. The severity of consequences range from insignificance to extreme, while the likelihood range from unlikely to most certain. Let's break down how this applies to the healthcare industry. First, we have operational risk. Operational risk is in healthcare often come from workflow inefficiency, inadequate staffing, and equipment failures. Which issue can lead to delays in patient care, increased operational costs, and reduced quality of care. The risk matrix for operational risk typically shows a major severity with a likelihood ranging of certain. This indicates that this risk require additional control measure and in some cases a risk treatment plan or RTP. Next, we have financial risks. Financial risks are driven by budget cuts, uncompensated care, and fraud. The consequences include financial loss, reduced funding for services, and potential legal penalties. In the risk matrix, financial risks are categorized as moderate severity and likelihood as possible. Immediate control and possible and RTP are necessary to manage this risk effectively. Next and lastly, we have clinical and patient safety risks. Clinical and patient safety risks arise from medication errors, infection, and diagnostic errors. This risk can result in patient harm, extended hospital stays, and legal liabilities. The risk matrix for this risk shows a major severity with a likelihood ranging as possible. The necessitates priority controls and RTP to mitigate this risk effectively. In conclusion, the healthcare industry faces significant operational, financial, and clinical risks that must be carefully managed to ensure the safety and efficiency of patient care. Utilizing a risk matrix allows healthcare organizations to prioritize this risk and implement the necessary control measures. By understanding and applying these risk management strategies, we can enhance the resilience and quality of our healthcare system, ultimately improving patient outcomes and organizational stability. Thank you.
Next, I will present about risk management strategy in the healthcare industry. There are two types of risk management strategy. Number one is education training, and number two is patient safety program. So for the education and training in the healthcare sector, education and training are essential for effectively implementing risk management measure. Healthcare organization can establish a robust risk management culture, improve workforce competency, and ensure efficient implementation of risk management strategy through a comprehensive approach to education and training. The key component include number one, integrating risk management framework, best practice, and principle into the relevant academic program and curricula. Number two, offering specialized healthcare risk management course, module, or certificate to provide in-depth knowledge and tools. Number three, providing ongoing continuing professional development through training and workshop, assessment, mediation, and response planning. Number four, emphasizing interdisciplinary training to promote collaboration and cross-functioning understanding of risk management. Number five, developing strategic risk management capability in healthcare leader and decision maker. Next, number six is utilizing simulation and scenario-based learning to evaluate the effectiveness of emergency response, produce, and risk management plans. Next is number seven, collaborating with industry group and regulatory agency to access relevant training material, best practice, and regulatory update. By investing in comprehensive education and training program, healthcare organization can establish a strong risk management culture, improve workforce, and ensure the efficient execution of risk management strategy, ultimately leading to enhanced patient safety, regulatory compliance, data protection, and overall organization resilience. Next, comprehensive patient safety initiatives are a crucial component of effective risk management in the healthcare sector. This initiative encompass multiple independent elements that work together to enhance patient outcomes, reduce risk, and strengthen organization resilience. The key component of patient safety initiative include number one, fostering a robust safety culture throughout the organization, promoting openness, transparency, and a non-punitive approach to error reporting. Number two, implementing robust accident reporting and analysis process to identify root cause and share lessons learned to prevent recurrence. Number three, actively involving patients and their family as partner in care, empowering them with education and tools to monitor and report safety issues. Number four, prioritizing medication safety through a standardized process, automation, and ongoing training for healthcare workers. Number five, ensuring smooth transition and handoff between care provider and setting to maintain continuity and coordination of patient care. Number six, leveraging healthcare information technology such as clinical decision support system and electronic health records to add safer, more informed decision making. Number 7, providing comprehensive training and continuous education for healthcare professionals on risk management and patient safety best practice. Number 8, committing to an ongoing monitor, review and continuous improvement of patient safety initiative, quality indicator and lesson learned. By integrating 8 multifaceted elements into their overall risk management strategy, healthcare organizations can effectively identify, mitigate and respond potential risks, ultimate enhance patient outcome and strengthen organization resilience.
For the professional liability or medical malpractice insurance, the objective of this insurance is prevent financial or fallout from malpractical lawsuits, and second is ensure the financial security and stability for medical professionals. For the functions is financial protection covers the defense expenses, settlements and awards from multi-practice lawsuits. Risk management provides a safety net against mistakes and omissions. Implementation needs assessment is evaluate risks and requirements for appropriate coverage, and regular review update policy regularly to address changing risks and needs. For the professional liability or medical malpractice insurance, the objective of this insurance is prevent financial or fallout from malpractical lawsuits, and second is ensure the financial security and stability for medical professionals. For the functions is financial protection covers the defense expenses, settlements and awards from multi-practice lawsuits. Risk management provides a safety net against mistakes and omissions. Implementation needs assessment is evaluate risks and requirements for appropriate coverage, and regular review update policy regularly to address changing risks and needs. That's all from me. Thank you.
Now, we come to the final part of this presentation, the conclusion. So, in conclusion, the healthcare sectors play a crucial role in enhancing the well-being of individuals and communities. To achieve its goals, it must employ a robust risk management strategies to ensure safety and efficacy in service delivery. Effective risk management involves the identification, assessment, and mitigation of risk to maintain high standards of care. Operational risks, such as workflow inefficiencies and equipment breakdowns, require constant attention to prevent delays and additional costs. Financial risks like budget cuts and uncompensated care must be managed through strict financial oversight and strategic planning. Clinical risks, including medication errors and infections, demand strict adherence to safety protocols and ongoing staff training. Healthcare organizations use enterprise risk management (ERM) and risk metrics to prioritize and address these risks. Additionally, takaful products such as machinery breakdown insurance and medical malpractice insurance support financial stability and ensure uninterrupted healthcare services. By implementing these risk management strategies, healthcare organizations can navigate challenges and continue to provide safe and effective care. That's all from our group. Thank you.